So the CDC is considering changing a key COVID-19 rule, and it has a lot of people, including health experts, talking. The Washington Post reports the CDC will propose removing the 5-day isolation guideline for those who test positive. Instead, people would be advised to leave their homes, return to their normal routines if they have been fever-free without taking medication for 24 hours. So let's talk about it. Joining me live tonight is Dr. Matthew Sims, an infectious disease specialist with Corewell Health. Thanks for joining me today, Dr. Sims.
Happy to be here.
So let's start with your initial reaction to what the CDC is considering. Do you think it's time to loosen up these guidelines a bit?
You know, it's a great question. COVID is certainly not the disease it was when this started in 2020. The number of patients admitted to the hospital are much lower. The number of deaths, of course, are much lower. That's an important point to consider. A lot of what the CDC is considering is really just sort of accepting what people are doing now, that COVID is sort of, for many people, become a mild infection. They're not even necessarily testing. They kind of stay home when they feel sick and leave when they don't. This is fairly along the line of what we tell people for other viral illnesses. But COVID, was a big problem over the last 4 years. So this is a big change.
Yeah. Is there a risk here that if they do establish this rule change, it might send a message to people that COVID is simply not a threat anymore and kind of have everyone let their guards down even further than they may already be?
So that is the big concern. One thing to remember, the CDC has said they are not considering this as a change for hospitals or areas that deal with sick patients, healthcare. This is more of a change for sort of the everyday environment for people. A big concern that a lot of people have raised is, as we take away this protection or this, period where you're not exposing, or somebody with COVID is not exposing themselves to other people and potentially spreading it, that we will see a rise in the amount of virus that's spreading in the community, and that may happen. Again, the concern is, we talk about COVID as compared to flu and COVID as compared to other respiratory viruses. But the thing is that even now, even at our lowest points, there's no point where we don't have 1 or 2 COVID patients admitted to the hospital. There's no point where we're not dealing with COVID, whereas flu is seasonal, RSV is seasonal, other things are seasonal. COVID's around year round, and that doesn't seem to be changing.
Yeah. So with this proposed rule, you only have to be fever-free for a day without medication. Right. Do you think people are really great judges of that? And isn't there any concern about other symptoms? I know I've been sick before. I didn't necessarily have a big fever, but still had some pretty active symptoms.
Yeah. So the biggest issue is when do people really stop spreading it, right? So again, a lot of that's going to depend on the person. People who have, low immune systems, they may carry the virus and spread it longer. So, again, each person has to be aware of what their particular risks are. For the average person, once they're fever-free, they're probably much less likely to spread it. It's not a zero. But, even at 5 days, it's probably not a zero. It's just hard to know. And remember, even if you come out of isolation, it's still not unreasonable, especially if you're coughing, to wear a mask so you don't potentially spread it to other people.
What would you say to someone who is more vulnerable, who is immunocompromised or has some kind of condition, who does need to worry about COVID more than maybe the rest of us? If this rule change does happen, what kind of advice would you give to those people?
Sure. Well, whether the rule change happens or not, I mean, I'm going to give the same advice for people who don't have a strong immune system. When you're out in public, when you're potentially being exposed to other people who may have the virus or have other respiratory viruses, wear a mask. And you should be wearing a mask that actually gives you personally more protection. So that's going to be a KF94, a KN95, or an N95. The regular surgical masks protect the people around the person wearing it much more than they protect the person wearing it.
Sure.
So wearing one of the higher filtration masks will protect the people who are most vulnerable.
All right, great reminders. We always appreciate your insight. Dr. Matthew Sims, thanks so much for joining us today.
Happy to be here.
And we do have a statement from the CDC saying, quote, "We will continue to make decisions based on the best evidence and science to help communities keep healthy and safe."